prenatal development of maxilla. Around fourth week, embryo develops six pharyngeal arches. From that first pharyngeal arches, which is mandibular arch, that's split into two process: maxillary process and mandibular process. Maxillary process responsible for the growth of upper jaws, cheeks, and side of upper lip, and mandibular process responsible for the growth of lower jaw. So 6 to 7 week, maxilla begins to harden at primary center located in the mesenchyme of maxillary process. So the bone does not start forming everywhere at once. It begins at one specific primary center, and this center is located in the mesenchyme of the maxillary process. Anatomically, this center appears precisely where the deciduous canine will eventually develop. It starts spreads from this center in several directions. In posterior moves backward towards the zygoma and tuberosity, anterior moves towards the incisor region, superior moves upward to form the frontal process, and palatal moves inward form hard palate. Now as the bone formation spread, two thin walls of the bone begin to grow downward towards the oral cavity, which is lateral alveolar plate, outer wall of the bone, and medial alveolar plate, inner wall of the bone. These two plates do not fuse at the bottom. Immediately they grow parallel to each other, creating U-space trug between them, and inside this bony trug there is a tooth germs lie. In typical bone development, bone replaces a pre-existing cartilage or form directly from the tissue, but maxilla is a membranous bone. They use secondary cartilage in areas where maxilla needs to grow rapidly and where needs to bridge gap to meet other bones, and these cartilages are malar, alveolar, and midline palate cartilage. Thank you.